Hello everybody, I am Dr. Abhishek Hoshing. I am the consultant ophthalmologist at Apollo Hospitals, Navi Mumbai, and today we will be discussing about a very important topic which is in discussion nowadays, that is mucormycosis, or which is commonly known as black fungus. So today we will be discussing what is mucormycosis, how it spreads, who are at risk, and what are the clinical signs and symptoms, and what to do in case of mucormycosis, or if you suspect that somebody might be suffering from mucormycosis. So mucormycosis is a fungus, it's a fungal infection. It is an opportunistic fungus, which means that it infects your body whenever the body's defense mechanisms are slightly weakened due to any cause. Various causes are there, and it is a very aggressive fungus, that is, it spreads rapidly. Usually it infects the nose, the paranasal sinuses. The sinuses are basically air-filled hollow structures in and around your nose and the eyeball. And from the nose and the paranasal sinuses, it can spread into the orbit. So the orbit is the bony structure which surrounds the eyeball, and also into the brain. So it is a very aggressive fungus and it can spread very rapidly. Also, it is spreading through blood vessels, which is why it can cause a lot of problems just by occluding the blood vessel, which means that by blocking the blood vessels, it can cause problems to the eye, the brain, and so on and so forth. So, very less time or no time should be lost to diagnose the condition, and the sooner we diagnose the condition, the better. And we'll be able to manage the patient well. So to understand that mucormycosis is not a new disease like coronavirus, this is not something which has come up recently. Mucormycosis has been there for a long time. We have seen a lot of cases of mucormycosis in the past too. Only thing, the coronavirus situation with the rampant use of steroids for the management has caused immunosuppression in a lot of patients, and that is why the mucormycosis is spreading very fast in these individuals. So, who are at risk? A person who has recently been infected with the COVID virus or has recovered from a coronavirus infection is generally a person who is at risk. Apart from that, if a person is a known diabetic, that is, he had diabetes which was not under very good control, or the control was lost during the coronavirus infection, then this person is also another person who is at high risk. Apart from these conditions like use of steroids for a long period of time for the treatment of coronavirus infections, use of medicines like tocilizumab, use of oxygen, mechanical ventilation with oxygen for more than 2 to 3 weeks. If the patient has received it, then these people are at a higher risk of developing the mucormycosis. So mucormycosis, like I said, it usually begins in the nose, and many times it is a normal commensal of the nasal cavity, which means that this fungus is sometimes present even in normal individuals. But because these individuals have a very strong immunity, it does not spread in them. So it spreads, or it turns rapidly spreading sort of infection in people who have the immunity compromised because of all these reasons which I enumerated. So the fungus starts its infection from the nose, and from the nose it can spread to the sinuses and also the orbit and also to the brain. Now, the involvement of the orbit or the eye is usually a slightly delayed condition, which means that if the eye is getting involved, then the fungus has already spread quite a bit, and usually according to a recent staging system which was proposed, the orbit involvement or the eye involvement comes almost to stage 3, which means that we have lost the opportunity of diagnosing or detecting the fungus in stage 1 or stage 2. So it is very important to keep a watch out for symptoms of stage 1 and stage 2. So what are these symptoms? So the common symptoms which a person can experience are stuffiness of nose. There might be heaviness on one side of face, there might be a little bit of swelling on one side of face, there might be numbness on one side of face, there will be discharge from the nose. Discharge could be either a watery discharge or it could be a sticky mucus like discharge. It could also be a blackish colored discharge, or it could also have some blood tinged appearance to it. So all these types of discharge is possible in a mucormycosis infection of the nose. When the fungus spreads from the nose to the sinuses, there is heaviness of that side of face, there is headache. The headache may be persistent, not responding to any treatment, and it can go on gradually increasing with no definite treatment seen. Apart from this, the eye symptoms which one can experience are swelling of eyelids or any sort of swelling in and around the eyelids. There might be numbness of the skin just below your eyelids on one or both sides, depending upon whether the fungus is infecting one or both orbits. The eyelid can suddenly start drooping. This is a very common symptom found in mucormycosis. So one eyelid suddenly starts drooping and one eye seems to be smaller than the other eye. There can be movement problems of the eye, that is, a person may find it difficult to move one eye, and when he tries to move that eye, he or she may experience diplopia. So diplopia means double vision. That means a person sees two objects when there is only one, either while looking straight or while looking in any particular direction towards the left, right, up or down. So all these are warning signs of mucormycosis infection. There can also be little bit of redness of eyes. There can be puffy swelling of the eyes. There might be bag-like fluid-filled swelling in and around the black part of the eye. The eye may appear slightly prominent and appear to be bulging out of the skull. So all these are very important features which one needs to report immediately if one is experiencing them. The uncommon feature, or one which is seen in very advanced stages, is sudden loss of vision of one or both eyes, depending upon whether the fungus is infecting one or both orbits. So these are some of the symptoms of mucormycosis. So what do you do? So the immediate thing that you need to do is either visit a ophthalmologist, which is an eye surgeon, or an ENT specialist, that is an ear, nose, throat surgeon, and he or she will do the necessary examination and refer to other specialties as seen fit. So remember, mucormycosis is not just a one specialty disease, because it can involve the ear, the nose, the paranasal sinuses, the orbit, and also can spread to the brain. So a whole team of doctors, including ENT surgeons, eye surgeons, orbit specialists, and neurologists and neurosurgeons may get involved in your treatment. The medicines are available right now. So usually early stages of mucormycosis is diagnosed by either a nasal endoscopy, which means endoscope is put in the nose and we examine the nose to look for any infective material, or there can be a nasal swab, which means a small cotton tip applicator is put in the nose to get some sample, and then that is sent for microbiological examination. Or it can also be diagnosed by MRI with or without contrast, depending upon what the surgeons deem fit. However, MRI with contrast is the one which is recommended. After diagnosis, the treatment usually includes injections of antifungal medicines, the most commonly being amphotericin. The treatment also includes a thorough cleaning of the nasal cavity and the paranasal sinuses, which is done by the ENT surgeon. So it is a surgical procedure, and during the same they can also understand the extent of the disease. If necessary, there can be some cleaning up or debridement, as we call it, done from the orbit, that is from the tissue behind the eye and around the eye. and sometimes we also give an injection of antifungal medicines behind the eye and leave a tube around the eye so that we can give further injections through the tube around the eye. It is very rare to have to remove the eye completely if the disease is diagnosed early. So this is also brief about mucormycosis, its early clinical signs and symptoms, and what is the course of medication and treatment that we take. Remember, people who have had COVID infections, who are diabetics, who have received steroids, who have received medicine like tocilizumab, who have been on mechanical ventilation with oxygen for 2 to 3 weeks at a stretch, and those who have had high ferritin levels during their course of treatment are susceptible, are at high risk. So if you are one of them and if you have any doubt, it is best to consult your doctor immediately rather than waiting and trying to treat it on your own. So with that, I would like to end this brief talk and would wish you that you stay safe and we can beat this disease together. Thank you.